Hello, my name is Ian McCall, and this is a video in the series of dermatology for dentists and dental students. We're going to look today at oral signs of immune system disorders. We've already dealt with quite a few of these in previous sections, particularly, say, the autoimmune diseases, conditions such as Sjogren's, where you basically have a reduction in the exocrine secretions of the tears, the salivary glands, and even some of the exocrine glands in the gut. Now, the problem with Sjogren's and the mouth is that it gives a dry mouth, and so you have all the problems that are associated with a dry mouth. Have a look at video 1 if you want to go over all of those. Then there's the other autoimmune diseases like lupus, which we've said can rarely cause blisters and certainly ulcers in the mouth. Pemphigus, especially Pemphigus vulgaris, which in about 90% of cases will present with blisters or erosions or frank ulcers. And epidermolysis bullosa acquisita, another one of the rarer immunobullous diseases that particularly presents with blisters on a normal skin-colored base on extensor aspects of the arms and the hands and feet at sites of trauma. But it can also present with blisters in the mouth as well. So these are fairly rare conditions. You're not going to see a lot of them. Sjogren's certainly is the one that dental students really should spend some time reading up about and knowing the ins and outs of that disorder. Many other diseases have immune considerations. Now, particularly graft versus host disease in bone marrow transplants. Now, this is often done for leukemia or myelomas. And the problem is that the bone marrow graft, it will in fact, in some cases, attack the individual's skin and the individual's salivary glands, any of the internal areas of the body as well. So this is why they're on a variety of drugs to try and suppress that. But if it does cause graft versus host disease, you'll see changes in the skin. Initially they're lichenoid, inflammatory, and later they're sclerodermoid. That means that they get collagen laid down the skin. The skin's quite hard, and it gets a sort of salt and pepper type pigmentary change. But it also affects the inside of the mouth, and this is this first image that we have here with severe oral ulceration and graft versus host disease. We'll look at these just in a minute. So remember, graft versus host disease, that's a particular situation where the immune system is disordered. But there are other disorders such as diabetes, and it will lead to a reduction in efficiency of the immune system, and mainly because anything that causes severe periodontal disease will stress the immune system. You've got chronic leakage of bacteria into the circulation. And after a period of time, this can have deleterious effects on the immune system. You've got some primary immune deficiency diseases. Now, these are rare. These are usually congenital disorders where there's a deficiency either in the production of T cells, production of immunoglobulins in agammaglobulinemia, or a reduction in neutrophils, phagocytic cells, or a defect in those phagocytic cells. There's a whole spectrum of primary immune system diseases. Now, anything that's going to cause a defect in the phagocytic and destructive function of neutrophils is going to give rise to infections. And certainly, not only will you get abscesses in the skin, you may well get severe periodontal disease and bacterial mouth infections as well. As I say, these are rare disorders. If you've got T cell deficiency, that tends to cause an increased incidence of viral infections in the mouth. And of course, the main acquired immune deficiency disease with T cell deficiency is HIV infection and AIDS. And we've shown before that you'll see chronic oral herpes infections, especially the angle of the mouth. Normally a herpes infection in an immunocompetent patient will be over in about 10 days. But if you've got an immunosuppressed patient, then these infections can last a lot longer and they can present as chronic ulcers just that won't heal. Then there's oral hairy leukoplakia. That's due to the Epstein-Barr virus. You know, it's that leukoplakic area along the side of the tongue. And again, that's, it's one of the hallmarks of HIV patients with reduced T cells. And then there's Kaposi's sarcoma, the vascular tumor that we've shown you before, presenting as a bruise-like lesion or a hemangiomatous-like lesion on the gingiva. And remember, it's due to herpes 8 viral infection as well. And then, people who have HIV disease are also susceptible to chronic oral candidiasis. So, HIV is an acquired immune deficiency disease that has a variety of both cutaneous and intraoral manifestations. And I think you'd really be well advised to read up on the oral manifestations of HIV disease. And then lastly, there's the condition of chronic mucocutaneous candidiasis. Now, this usually presents in children. Some cases are autosomal recessive. Others don't have any don't have any genetic predisposition. And they just have a specific defect in dealing with Candida albicans. Their immune systems will work in dealing with other infections, but not with Candida albicans. So they'll present with severe oral candidiasis, with plaque-type candidiasis covering the inside of the mouth, with severe angular cheilitis. But they'll also get Candida affecting vaginal and genital areas, or even affecting the nails with thick nails and severe nail dystrophy. But and occasionally it'll affect the scalp as well, and they'll get various papules and sometimes even nodules of solid Candida in amongst the hair with hair loss. So this again is a rare condition, but it certainly has significant oral manifestations, chronic mucocutaneous candidiasis. Let's have a little look at some of these images. Okay, this was graft versus host disease. You can see the severe hyperemia here and inflammation, the ulceration, the sort of leukoplakia type changes, because a lot of the pathology here is very similar to severe lichen planus. There's a lot of damage at the junction between the mucosal surface and the dermis, or the lamina propria, and below in this in the inside of the mouth. Let's have a look at this. There's the changes that you'll see. It's a relatively mild example of oral hairy leukoplakia. White rippled leukoplakic deposit or change in the epidermal surface and the mucosal lining surface of the tongue due to the EBV virus, and seen particularly in people with low T cells who have HIV disease. This was a little girl you've seen before with chronic mucocutaneous candidiasis. Look at the extent of the candida that she has on her tongue here and on the lips as well. This is another one that you've seen. This was an HIV patient who had cytomegalovirus, and it wouldn't surprise me if there was herpes virus in there as well, with that ulceration, severe angular cheilitis. And these ulcers, some of which can look almost aphthous ulcer-like, but they're really extensive. Okay, these were the main things with immune deficiency that I wanted to talk about. Let's just go back to the presentation itself. Just recap. So, immune system disorders, there can be the autoimmune diseases, especially Sjogren's with the dry mouth, lupus, and pemphigus. Pemphigus certainly can present with blisters and erosions in the mouth, and epidermolysis bullosa acquisita, a rarer immune deficiency, a rare autoimmune disease. Graft versus host disease in bone marrow transplants, diabetes, and then any cause of severe periodontal disease having an indirect effect on the efficiency of the immune system. Then the rare primary immune deficiency diseases, diseases of T cells, diseases of immunoglobulins, diseases of neutrophil function. And particularly the deficiency of neutrophil function will give rise to severe periodontal disease. Deficiency of T cells will give rise to increased viral mouth infections. And the main acquired immune deficiency disease was HIV or AIDS. And there were some of the oral manifestations that you'll see in HIV patients: Kaposi's, oral hairy leukoplakia, chronic oral viral herpes virus infections. We also mentioned cytomegalovirus infection. I think we mentioned an increased incidence of lymphomas in some of these patients, and also chronic oral candidiasis, and then that rare condition of chronic mucocutaneous candidiasis presenting as severe candida infections in various parts of the body and the nails. Okay, I hope that's a reasonable overview of these. Concentrate on Sjogren's, concentrate on HIV disease if you're having to answer a question on this. Try and remember a little bit about the primary immune deficiency diseases and throw in chronic mucocutaneous candidiasis for the extra mark. Thanks very much.